Hello, I'm Dr. Alexandru Grigorescu from Hospital of Nephrology, Davila, Bucharest, Romania. And first of all, I want to thanks very much to organizer of this conference for invitation. Now, I want to present a particular aspect in oncology, association between lung cancer and prostate cancer. Just a moment, please. This is my exposure. In introduction, I want to mention that this association between lung cancer and prostate cancer is rare and is not mentioned too much in literature. On the Mayscape, for example, do not have any reference to this association. Starting from my three concrete cases regarding this association, we try to make a review related to particularities of the patients who were diagnosed with this two malignant disease. We analyzed the observation sheets of three patients who were treated for lung cancer and who, after approximately 3 years, were also diagnosed with prostate cancer. We did not have the possibility to use molecular and genetic analysis in addition to testing there were performed EGFR, ALK, and PD-L1 for lung cancer, and BRCA for prostate cancer. We analyzed 10 articles, the only articles found by AI on this topic. We tried to define the main feature of the patients with this association. The results of our investigation, we analyzed these three cases that had been in treatment for over 5 years for non-small cell lung cancer, but after approximately 3 years start and the second malignancy, prostate cancer. The three cases were non-small cell lung cancer, in particular adenocarcinoma. The characteristics of patients were age between 60 and 65 years old at the beginning, residence, one patient lived in a rural area and two patients lived in urban area. All patients were in stage 4 of disease, lung cancer, respectively. All were former smokers. Prostate cancer for these three patients was diagnosed in early stage. All patients had EGFR, ALK, PD-L1, and BRCA negative. Articles selected by AI, Article 1 was the purpose of the study to investigate the prevalence of pretreatment lung abnormality among prostate cancer. It is not the subject interesting for us because it's not referred to the lung cancer. The second article regarding the multiple additive and interactive association of 25-hydroxyvitamin D with lung and prostate cancer. There was no epidemiological relationship of pre-diagnostic 25-hydroxy D concentration with the incidence of lung cancer and prostate cancer. The respective association of smoking and age at these patients above 50 years old with lung cancer and prostate cancer were additive rather than multiplicative. In Article 3, analyze the impact of lineage plasticity on cancer progression and resistance, with a focus on neuroendocrine transformation in lung and prostate cancer. The histological transformation of adenocarcinoma to aggressive neuroendocrine carcinoma was initially described in lung cancer harboring EGFR mutation, and it was subsequently reported in multiple other adenocarcinomas, including prostate cancer, in the presence of antiandrogens. This is important for clinical practice. Article 4. The authors reported the case of a 73-year-old man with prostate cancer and rising prostate-specific antigen levels. GAPSMA PET-CT was performed, which showed a focal lung lesion with subsequent histological confirmation of adenocarcinoma of the lung. Incidental lung lesion on GAPCMA in prostate cancer patient should elicit a differential of primary lung malignancy, especially in clinical and morphological suspicion is high. In Article 5 is described the case of 63-year-old man recently diagnosed with carcinoma of the prostate, Gleason score 4+4, with serum prostate-specific antigen 189.2 nanograms by milliliter, who underwent GAPCMA PET-CT scan for a pretreatment strategy. The study revealed abnormal tracer uptake in the prostatic bed region, the pelvic, abdominal, and mediastinal lymph nodes, and diffuse metastasis to the bilateral lungs. The lung metastasis was proved to be metastatic lung adenocarcinoma from analysis of bronchoalveolar lavage. In Article 6, this article deals with the surgical indication for pulmonary metastasis of prostate cancer. The authors are in favor of the list their biopsy to eliminate other etiology is safety and effective in selected prostate cancer patients with recurrent disease. In Article 7, it's about the highlights of the importance of smoking as a risk factor in prostate cancer, and certainly highlights once again the common risk factor for lung cancer and prostate cancer. Article 8. Describe another particular aspect of the presentation of prostate cancer. Can have pulmonary metastasis without also having bone metastasis. This case highlights once again the necessity of diagnostic biopsy. Article 9 investigates the relationship between vitamin D, level, and cancer incidence, including prostate and lung cancer in older men. In conclusion, the authors revealed that vitamin D is a predictive marker in prostate cancer, but not in lung cancer. And Article 10 is a meta-analysis shows that systemic lupus erythematosus patients are at an increased risk of developing cancer, particularly of the lung, bladder, and liver. However, males with CLE have a decreased risk of prostate cancer. In conclusion of these articles, from my analysis, the study and case report, we have drawn some things that must be taken at home. Thus, from the article studied is emerged that this association is rare. Most authors have studied prostate cancer, lung metastasis, and not primary lung cancers associated with prostate cancer. In articles studied the metachronous association of small cell lung cancer is presented, while our cases series was represented by cases with non-small cell lung cancer. A case that we selected from the recommended articles overlaps somehow our experience regarding the association lung cancer, prostate cancer, but it cancers a patient who developed three successive cancers, and lung cancer was represented by small cell histology. Also, in conclusion of these articles, the metachronous associations of small cell lung cancer is presented, while our cases series was represented by case with non-small cell lung cancer. We emphasize these things again. Also, in the articles studied, it is relevant that lung cancer is usually the second cancer that appears in the evolution of patients, while our cases had a reverse sequence of appearance of two cancers, the first being lung cancer. We have to discuss about some genetic aspects. The most studied way of genes' role in the cancer is through acquiring genetic mutations known as somatic mutations. These changes occur in lung cells during a person's life and are not inherited from parents. This mutation acts by instructing cells to grow and divide uncontrollably. Most common mutation in EGFR, epidermal growth factor receptor gene, can make lung cells continuously activate growth signal. Also, rearrangement of fusion involving the ALK, anaplastic lymphoma kinase, gene can produce abnormal proteins that drive cell growth. Other frequently mutated genes include KRAS and BRAF, which are part of cell signaling pathway. PD-L1 protein can be affected too, helping cancer cells evade the immune system. This being also significant somatic alteration. Identifying this drive mutation is crucial for therapeutic intention. Genetic in prostate cancer also has a great importance. Variants in
gene involved in DNA mismatch repair, particular BRCA1 and 2, ATM, CHEX2, and NBN, have been associated with an increased risk of developing prostate cancer in men with advanced metastatic prostate cancer, in men without family history, as well as in men with familial prostate cancer. Genetic, also in prostate cancer, we have to present the review by Picard et al. Of 69 men with metastatic castrate-resistant prostate cancer, revealed a germline DNA repair gene variant in 11.8% of all men, across 16 genes, including BRCA, ATM, CHEK2, PALB2, and RAD5-1D. These men were unselected for age at diagnosis of family history status. In men with localized prostate cancer, a lower frequency of germline DNA repair gene variant of 4.6% was found. However, when specifically grouping men by NCCN risk criteria, 2% of men with low intermediate risk have germline variation in DNA repair genes. Patients who carry germline variation in BRCA2 with metastatic prostate cancer have superior response to PARP inhibition and platinum chemotherapy. Another phase of the problem is represented by epigenetic features of lung and prostate cancer, because you understand that in genetic these two localizations have no any common modification. But in epigenetic, it's another things. Notable epigenetic similarity between lung cancer and prostate cancer, despite their distinct tissue origins and genetic drivers. These similarities are primarily observed in the types of epigenetic alteration that contribute to tumorigenesis prognosis and therapeutic resistance. Key shared epigenetic features include aberrant DNA methylation. Both cancer fragments exhibit hypermethylation. Histone modification, altered histone acetylation and methylation, aberrant histone modifications, and non-coding RNA dysregulation. Both cancers demonstrate altered expression of specific mRNAs that regulate KIT oncogene and tumor suppression pathway. Epigenetic similarity aspects between lung cancer and prostate cancer means and epigenetic plasticity and therapy resistance. Both lung and prostate cancer can undergo leaning plasticity, often in response to targeted therapy. Anti-androgen in prostate cancer, EGFR inhibitors in lung cancer, which is mediated by epigenetic reprogramming. Therapeutic implication, epigenetic alteration contribute to resistance mechanism in both cancer, and epigenetic therapy are under investigation in both settings.
Biomarkers and clinical implications. Early detection and prognosis, epigenetic changes, particularly DNA methylation pattern, are being explored as biomarkers for early detection, prognosis, and risk stratification in both lung and prostate cancer. Reversibility. The reversible nature of epigenetic modification make them attractive therapeutic targets in both malignancy. In general conclusion, the association of lung cancer with prostate cancer is rare. There are no many cases described in medical literature. The core driver mutation and actionable target are distinct between lung and prostate cancer. There is limited overlap in certain pan-cancer susceptibility genes, TP53 third DNA repair genes, and circadian pathway genes, but this do not translate into major clinical similarities in genetic testing and targeted therapy selection for most patients. In our experience, the patients had first lung cancer and secondary prostate cancer with a survival from the diagnosis of metastatic lung cancer of 5 years and more. The second cancer was prostate cancer, also with a good evolution determined by early diagnosis. Data from literature and the study reveal the importance of genetical tests for assessing the disease progression and selection of therapy. The epigenetics of both cancers are similar and could be diagnosed by biopsy. The treatment must be also take into account the epigenetic aspects. Thank you very much. This is our National Oncologic Journal, in which I will publish this study of association between lung cancer and prostate cancer. Thank you again very much. Goodbye.